We're rolling?
Yeah.
Fuck, we're rolling? All right, welcome back, guys. Today I'm here with the most successful orthopedic surgeon in New York City.
I wouldn't say that.
The handsomest.
I'm just a guy, you know? Dr. Sam Elguizaoui, orthopedic sports medicine surgeon here in New York City.
I've always had trouble with that last name, so I always say Dr. Sam.
That's fine too, yeah.
We're here in Cafe Integra. We're gonna grab a coffee and we're gonna talk about delivering information. Let's do this. I feel like my experience, like sometimes I work with other doctors or the narratives coming in, it'd be like, oh man, you know, so-and-so told me I have a back of like a 70-year-old and that person's like 18. And maybe that's a great way to deliver information if they were like 85, you know? Like, you got a back of a 70-year-old and I'm 85, but it's like, no man, like someone will come in and they're like 18 years old and someone's like, yeah, my back looks like it's a 70-year-old back. And I'm just like, damn.
How do you get out of that hole, right? You're starting already behind the line.
Yeah, like, do you have any experience with that? With like, I'm not sure, like.
Yeah, I think there's a lot of art in the way that you deliver information, whether it's from test results. You know, I see a lot of MRIs, a lot of CT scans, X-rays, that kind of stuff, or just, you know, how people do based on your exam. You can package things in very certain ways, either to kind of back your narrative. So if you want someone to kind of believe that this certain treatment or this kind of process is the best process, you can kind of, you know, deliver things a little bit differently. For me, it's always about, hey, I get an MRI report. There's a lot of crazy words that the radiologists use. It's like, you know, and they always paint a very...
There's always a cyst of some sort. You gotta throw a cyst.
There's always a cyst, and it's always
something's gotta be degenerating.
Yeah, but it's about how do you interpret that, right?
Yeah.
And then kind of repackage that for the normal person to understand and also not get too freaked out about. So if we went through every word, it gets to be overwhelming and people start Googling, right? They go straight to Dr. Google. They're like, yo, what does this mean? Am I dying? Should I sign up for surgery now? And it's about how can you deliver the information to make it, that some things are important or more important than other things, and then you can kind of come up with the best treatment plan for people.
You feel like that's something like you've taken into consideration, like as you started practicing, or like right off the get-go you realize like, damn, this is like really important, like how I deliver, the way I get the results and stuff like that?
Yeah, I think practice is, you know, you learn a lot when you're starting practice and how you talk to people, how you deliver information, how people respond to that information. You know, there's a lot of people that will see an MRI, like doctors, I'm saying, will see an MRI report, not even, number one, don't look at the images, number two, don't examine the patient. They're just going off the MRI report and they're making recommendations based on that. I've seen that through my training, I've seen it kind of in practice here too, and they're recommending maybe aggressive treatment plans, whether likely surgery, as opposed to saying, hey, well, if we scanned everybody walking the street, what's the probability that that person that doesn't have pain also has the same issue? You know, it makes a big difference, because then you can say, let's try the non-operative conservative stuff first. So it's about synthesizing that data and information and trying to, you know, do what's right for the patient ultimately.
Damn, do what's right for people.
It's a crazy notion.
Crazy idea.
Crazy notion.
No, but I think like when I started realizing that, because before I was like, man, you know, MRI report comes, generative, there's probably things that can explain what someone's experiencing. Then you read others' research coming out, it's like, wow, 80% of people, you know, have this degenerative changes in their spine, or like there's a lot of people with asymptomatic disc bulging.
100%.
And it's crazy. And then you can look at other literature. Something I just uncovered recently was like hip labral tears, and
Hot
it's like
topic, man.
crazy stuff, because like they did studies on like professional hockey players that are asymptomatic, and they tracked it like within 5 years, and 90% of them with labral tears that were asymptomatic were still playing professionally. So
and the flip side of that is if you fix those labral tears, so if you're one of the people that kind of is quick to do that or you know, become operative, then how do those people do afterwards, right? And it's not always a slam dunk. It's not like just because you have something on an MRI and we operate that you do well. There's people that do well, there's people that don't, and that's where I think managing expectations and understanding that there's a lot of options even with positive MRI findings, I think is important.
That's why I really like working with you, and I always refer people your way, and even if I'm unsure about something, I'm like, man, just go to Dr. Sam. Because I could be like, oh, go see someone else, but if someone sees something like that, and maybe there is a labral tear, but they'll say something like, oh my gosh, it's the worst labral tear I've ever seen.
Yeah.
And when you deliver something like that, you can just tell someone, yeah, there's a labral tear. And then you say oh, that's the worst labral tear I've ever seen. I guarantee you that person's probably gonna feel even worse tomorrow, right?
Yeah, there's definitely a mental component to it, or psychological component. I think that when you sensationalize anything, then people tend to start to really think about it a lot. And then they're hypersensitive or hyper aware of wherever that pain is coming from. And so they make a wrong turn. They're like, that's my labrum. It's my labrum. That's it. I gotta get surgery. And that's just not the case, right? I tend to try to bring things to the median, to the average, and say, well, yes, you have this. Could it be a source of your problem? Maybe. Let's try options A, B, or C, and see what you respond to. And then if you get better, then we don't really care, number one, what the MRI shows. Who cares? Because you're not having pain, your function's not limited, you're able to play the sports you want, do what you want to do. So don't worry, don't focus, or focus really on just what the MRI shows.
Do you find yourself talking a lot of people off the ledge?
Yeah.
Guys.
Seems like we have a lot of commonality.
I feel for instance, giving someone hope back, right? It's almost half the job. On my end, it's I gotta show this person that one, you can have a positive outcome without needing anything more invasive. But it's almost it's hard for you, right? Because it's gotta be I'm the surgeon, but I'm gonna try to tell this person that they don't need surgery to have a positive outcome. Yeah,
I think people have a preconceived notion when they come into a surgeon. They're like, this guy's not gonna listen to me. He just wants to cut. That's his thing, right?
Yeah.
And so I'm gonna only take it with a grain of salt, and I'm gonna do my own research. I'm gonna kind of figure out what I want, which is, you should always do your own research, number one. But for me,
PubMed.
PubMed research.
We're not
Dr. Google.
Yeah.
But for me, I tell it straight up. I'm like, listen, I'm a surgeon. I love to operate. Just 100%. That's if I could only do that, that'd be great. But if I
could tell because you just start smiling.
Yeah, no, because it's fun.
Yeah.
I'm a carpenter at heart. I just like to use these hands and build stuff. But if I can make you better without a surgery, I think that's a win for both of us. Number one, you trust me, right? It's not that I'm just doing what's best for me, but I'm doing what's best for you. And number two, if you have a problem, number two, you've gotten better without a surgery, right? Number three, if something does happen, in the future that does need surgery, then we know that we've done the right things to get you to the place where you can have the best outcome.
No, I love that, because I feel that's a similar thought process. It's I don't want this person to come back to physical therapy for the rest of their life. I don't want to have to sell something oh, you need maintenance care to come back twice a week for the next, not even the next 2 years, for the rest of your life. There's honestly people that get adjusted and get all these treatments, and they're I have to maintain, my function.
Right.
And for me, it's like you said, if I can get you to a point where you don't need to come back, I've done my job. Yeah. If you can get someone better without having to get surgery, that's still, you've done your job well. Yeah.
It's a win, because, at the end of the day, I want people out there doing what they love, so whether it's playing golf or, running a 4.40, that's whatever it is that keeps you mentally happy, because I think physical activity has a huge role in mental health and staying happy.
Yeah.
That's the goal at the end of the day. So if I can do that without surgery, that's great. If there's always going to be people that need surgery, and I think that those people will also do great because they're motivated. It's one of the reasons why I like sports medicine, and I chose sports medicine in the field. But it's just about finding the right treatment for the right person, and then having honest conversations.
Do you feel in terms of delivering information like that, is there certain barriers that you have to almost get through before you can kind of tell someone a truth that kind of goes against their beliefs?
There's a lot of counseling that happens. If I think that you are likely going to do better with surgery, or that the MRI or whatever test finding kind of pushes us in one direction or another, I spend as much time as needed for that patient to feel comfortable with the plan moving forward, because a lot of times people don't hear everything that I'm saying anyway, so then we're repeating, because I know it's like a shock at first.
Yeah.
And so I tend to run late sometimes in office because of that. But I tell every patient too, I'm going to give you the same amount of time that I give everybody else. Sometimes you're going to have problems that take more time to discuss, and we just kind of work through it. So delivering that information in a way that is consumable to that person, I think is important for good kind of relationship between you and the patient. So.
Sure, yeah. That's so much of like, especially when someone like starts to identify with their thoughts and beliefs that might not necessarily be true. It's almost that becomes a part of them.
Yeah.
So like to give them information like right away when they don't even like trust you is like, what up? Who the hell is this guy telling me that this doesn't equal pain or this might not be relevant?
Yeah.
When I don't even know who you are.
Right.
You know?
Yeah, and I think everybody's pretty knowledgeable. We have so much information at our fingertips now. So I think everybody comes in already having a diagnosis in their mind, or what they want, or how they think is the best way to approach things.
Yeah.
So those patients are a little, and there's varying degrees of how aggressive
Someone's like, wow,
are.
you're really good.
Yeah,
Like you're spot on.
Varying degrees, and I'm like, someone like, well, why are you here? If you already know everything, like, what am I doing for you? But it's just about figuring out what the underlying problem or fear or motivation is for that kind of intensity too.
Yeah.
But I think you're right. I think packaging and delivering information can make a huge difference as to how people, number one, perceive you as a clinician, and also how they perceive their treatment and outcome.
Yeah. So appreciate you guys checking in with us. If you got any questions for Dr. Sam and I, we're probably gonna run this back a couple of times.
Yeah, this is fun. We should do this more often.
Yeah, if you want to take from an orthopedic surgeon and a physical therapist on a specific topic, in the comments below. And yeah, till next time, guys.